Hey y'all, what's going on? This is Jackie, and today I'm making a video about Make America Healthy Again, 6 healthcare positions of RFK Jr. So RFK Jr. is Robert F. Kennedy Jr., and he has been nominated to lead the HHS, which is Health and Human Services, under President Donald Trump's second term. And he brings a range of healthcare positions that could directly and indirectly influence public health, pharmaceuticals, and health systems. If Mr. Kennedy is confirmed as the Secretary of HHS, he will be the 26th leader of the agency. And given HHS vast budget of $1.8 trillion in 2024, Mr. Kennedy's leadership could shape significant policy directions, resource allocations, and more. He will oversee critical agencies like the CDC, FDA, and NIH, shaping policies that impact millions of Americans. So this article, it just lists 6 of his positions on health related issues, and we're going to discuss them. So the first is Mr. Kennedy has prioritized addressing chronic disease, which accounts for over $1 trillion in US healthcare costs. So every year we spend $1 trillion just because of all these chronic diseases. So he stated that President-elect Trump seeks measurable impacts to combat the chronic disease epidemic within 2 years, a goal that has drawn attention from healthcare leaders, some of whom have praised the ambition while noting potential challenges. Mr. Kennedy identified chronic disease as a key priority before his nomination to lead HHS. I'm going to urge President Trump on day one to do the same thing that they did in COVID, which is to declare a national emergency, but not for infectious disease, but chronic disease. He has criticized the influence of the pharmaceutical and food industries, linking issues like obesity and diabetes to ultra processed foods, federal subsidies, and dietary guidelines. He calls for reforms targeting food additives, pesticides, and environmental health risks alongside overhauls of agencies like the CDC and FDA. And if you recall, right before Trump was inaugurated, the FDA got rid of red dye all of a sudden. The second thing that Robert F. Kennedy is calling for, he's calling for the end to direct-to-consumer advertising for prescription drugs. So he has criticized the advertising relationship between pharmaceutical companies and news outlets, arguing that pharmaceutical advertising influences editorial content and public discourse beyond its intended purpose of promoting a product. So basically what he's saying is, we see pharmaceutical companies, we see their advertising on TV. And it's usually, we see it on all different channels, but we see it on like Fox, we see it on NBC, we see it on ABC, we see it on these channels too. And they do news. So all these channels do news, MSNBC, CNN, they all do news. And they also run ads for the pharmaceutical. So if the pharmaceutical has a drug that may not be good for the American people, well, CNN, Fox, MSNBC, ABC, they're not going to say anything, because if they criticize the pharmaceutical company about that drug that is not good for Americans, then they won't get the advertising money. And so that's what he is criticizing. He's like, that needs to stop. So tell me what y'all think about that. And then number 3, he has expressed interest in redirecting Medicare spending towards promoting healthy behaviors rather than covering certain pharmaceuticals. So Mr. Kennedy has been a vocal opponent of Medicare and Medicaid funding for GLP-1 drugs used for weight loss, arguing that these programs should instead prioritize covering gym memberships and healthier food options for enrollees. For half the price of Ozempic, we could purchase regeneratively raised organic food for every American, 3 meals a day, and a gym membership for every obese American, Mr. Kennedy said during a congressional roundtable in September. So what do y'all think about that? Number 4, he has considered changing the Medicare physician fee schedule. So Mr. Kennedy and his advisors are considering an overhaul to Medicare's payment formula four anonymous sources told the Washington Post in November. The move could mark a bid to shift the health system's incentives towards primary care and prevention. So basically, they just trying to overhaul the disparity because doctors get paid for performing procedures and services. So if you have a specialist like a cardiologist or urologist or any type of a gastrologist, any type of doctor like that, well, they're always doing procedures on you, as opposed to your primary care, because they're the least paid. Okay, your primary care is the least paid because what services do they do? What procedures do they do? They don't do anything. I'm not saying that's a bad thing. I'm just saying they don't do anything. You go to a cardiologist, they do you get an EKG done, you get an ultrasound done. You gastrologist, they might you do all kind of procedures, but with your primary care, you don't really do anything. So they are your primary care, who knows you better than anything. They're getting paid less, and these specialist doctors are making the money because physicians get paid based on procedures and services. So that's why I'm saying it needs to be a change. That's why we always getting all these procedures done. We always got to come back we got to come back next week, the week after. We get the procedure done and then we got to wait 2 weeks to get the results so they can bill it again. It's a lot going on. So tell me what you think about that. And then number 5, he has raised controversy and widely challenged claims about vaccine safety for nearly 20 years. So Mr. Kennedy's suspicious of vaccines dates back to at least 2005 when he published an article called Deadly Immunity in unusual publications for the topic. Rolling Stone magazine print and Salon Digital. The article claimed that thimerosal, eliminated in routine childhood vaccine in 2001, caused autism. The article was amended and corrected several times before years later. Most recently, Mr. Kennedy said in a 2023 podcast interview that there is no vaccine that is safe and effective. The nonprofit that Mr. Kennedy has aligned with for nearly a decade, Children's Health Defense, has been a vocal critic of COVID-19 vaccines and public health mandates, with its claims frequently challenged by public health experts. The group has filed dozens of federal and state lawsuits since 2020, many challenging vaccines and public health mandates. Mr. Kennedy has been on leave from the group as its founder, chairman, and chief litigation counsel since he announced his plans to run for president in 2023. When described as anti-vaccine, Mr. Kennedy has pushed back. Instead, he argues that he wants to improve the science of vaccine safety. We're not going to take vaccines away from anybody. We're going to make sure that Americans have good information. Right now, the science on vaccine safety particularly has huge deficits in it. And we're going to make sure that those scientific studies are done and that people can make informed choices about their vaccination and their children's vaccination. So, what do you think about that? Number 6, he supports abortion rights up until the point of fetal viability, after which he favors restriction. So Mr. Kennedy believes abortion should be legal up to the point he describes as when the fetus becomes viable outside the womb, after which he supports restrictions. He acknowledged that his views on abortions have evolved over time as he continued to explore the issue. In May 2024, he has expressed support for a woman's right to choose an abortion at any stage of pregnancy, including full term. Mr. Kennedy has also pointed to the importance of addressing economic factors in discussions about abortion and reproductive health. We should be looking at why there are so many abortions in the first place, he said, emphasizing the need to understand the financial challenges and economic pressures that contribute to abortion rates among individuals and families. So, yeah, what do you think? So, he hasn't been confirmed yet. As of making this video, he has not been confirmed. You think he'll be good for being in charge of HHS, which is over the CDC, FDA, CMS, and NIH? So what you think? Put your comments below. You got any questions, you can put them below as well. Don't forget to like the video, subscribe to the channel, and I'll talk to you later. Bye.